Hello, today I'm going to talk about the ultrasound guided ulnar nerve block. With an ulnar nerve block, you can perform surgical procedures on the ulnar side of the hand. When combined with a median nerve block, you can cover most of the palm side of the hand. Positioning. The arm should be abducted and placed in a slightly supinated position. The doctor sits on the lower side of the patient. Position the ultrasound video monitor on the upper side of the arm, and the needle will be inserted in this direction. Generally, we use a 25-gauge needle. The needle size is selected based on the depth of the soft tissue. In this video, the arm's orientation is displayed on the ultrasound screen. The left side represents the radial side. The right side represents the ulnar side. When you place the probe on the wrist, it can be difficult to identify each structure in a single static image, even for experienced doctors. By following the structures in sequential frames, you can identify the ulnar nerve, which continues to show its bundle-like structure. Remember, always identify the nerve in sequential frames, not just in one frame. Let's review the anatomy around the ulnar nerve. In the distal area, here are the bone cortices. The ulnar nerve is located close to the ulnar artery, and both are covered by the flexor carpi ulnaris, FCU. At the same level, you can also find the dorsal branch, which innervates the dorsal ulnar side of the hand. In sequential views, you'll notice that the dorsal branch joins the main ulnar nerve in the proximal area. We will now move the probe proximally. In the proximal area, the nerve passes between the flexor muscles, moving away from the artery. Let's move further proximally. The nerve lies in the groove of the bone, known as the cubital tunnel. In this area, injections should be avoided, because the ulnar nerve runs through a narrow space between the bone and the flexor carpi ulnaris. The best area for the nerve block is approximately halfway up the forearm, where the ulnar nerve passes between the flexors and is separated from the artery. Using a smaller needle is important to minimize pain. The injection is performed from the ulnar side of the forearm. In the ultrasound view, move the probe towards the radial side to bring the ulnar nerve closer to the injection site. The needle is inserted parallel to the probe plane. The nerve lies between the fascia of the flexor muscles. The injection target is the fat tissue surrounding the nerve bundle between the fascia. A small amount of fluid spreads the space around the nerve, and more fluid is injected to fully surround the nerve bundle. You can see the fluid spreading around the nerve. That's all for this video. Remember, don't rely on identifying structures in a single static frame. The nerve should be detected in sequential frames. Avoid performing injections near the cubital tunnel due to the risk of nerve injury. In another video, you can learn how to control the needle under ultrasound guidance. On this channel, I will continue to provide valuable basic techniques in ultrasound. Please subscribe if you're interested.